Have you ever wondered what it's like to experience the world differently, in a way that's unique and distinct from most people's perceptions? Imagine that for a moment. That's the reality for individuals with autism spectrum disorder. Known as ASD, it's a complex neurodevelopmental condition that presents a variety of challenges. These can include difficulties with social interaction, where understanding social cues or forming friendships might not come as naturally as it does for others. Communication can also be a hurdle, with some individuals experiencing delayed speech development or struggling to comprehend nonverbal cues like gestures or facial expressions. Repetitive behaviors too, such as hand flapping or strict adherence to routines, are common characteristics of ASD. And let's not forget sensory sensitivities, where light, sound, touch, taste, or smell can be either overpoweringly intense or barely noticeable. But remember, autism is not one size fits all. It's a spectrum of experiences, symptoms, and behaviors. How do we recognize autism? The signs can be subtle or pronounced, but they generally revolve around social interactions, communication, repetitive behaviors, and sensory sensitivities. Difficulty with social interactions is a key symptom. Individuals may struggle to understand social cues, avoid eye contact, or find forming friendships a challenge. Communication can also be a hurdle, with some individuals experiencing delayed speech development or not speaking at all. Non-verbal communication, like interpreting gestures or facial expressions, may also present a challenge. Repetitive behaviors are another sign. These can include repetitive movements like hand flapping or rocking, adherence to routines or rituals, and an intense focus on specific interests. Sensory sensitivities are common too. Many individuals with autism experience heightened sensitivity or decreased sensitivity to sensory stimuli such as light, sound, touch, taste, or smell. Understanding these symptoms is the first step towards early diagnosis and intervention. What causes autism? The answer isn't straightforward. It's a combination of genetic and environmental factors. Let's delve a bit deeper into this. On the genetic front, it's clear that autism tends to run in families, implying a certain genetic predisposition. But it's not as simple as pinpointing a single rogue gene. Instead, it seems a complex interplay of multiple genes may be at work. Now, let's turn our attention to environmental factors. These are elements encountered before and around the time of birth. Certain prenatal factors like maternal infections, exposure to specific medications or chemicals during pregnancy, and complications during birth may increase an individual's risk of developing autism. It's important to note that these factors alone don't cause autism. It's their interplay with genetic factors that appear to set the stage for autism. While we don't have all the answers yet, research is continually shedding light on the complexities of autism. Although there's no cure for autism, numerous treatments and support strategies can improve the quality of life for those on the spectrum. Treatment isn't a one-size-fits-all approach, but rather a tailored plan to suit the individual's unique needs, strengths, and challenges. Behavioral therapies, such as applied behavior analysis, offer structured environments to help individuals learn and reinforce desired behaviors while reducing harmful or undesired ones. Speech therapy can support those who struggle with verbal communication, helping them express their thoughts and needs more effectively. Occupational therapy assists with mastering daily living skills like dressing, eating, and socializing, while social skills training fosters improvement in interpersonal interactions. Beyond therapies, medication can play a role in managing co-occurring conditions such as anxiety, depression, or ADHD. It's essential to remember that every individual with autism is unique, and what works for one may not work for another. With the right support and interventions, individuals with autism can lead fulfilling lives. How does society view autism? There's a growing recognition of the strengths and unique perspectives that individuals with autism bring to the table. Advocacy organizations play a pivotal role in this shift. They tirelessly work to raise awareness, promote acceptance, and improve access to resources and support services for individuals with autism and their families. A key moment in their efforts is World Autism Awareness Day, observed annually on April 2nd. This global event serves as a platform to increase understanding and acceptance of autism worldwide. But the advocacy doesn't stop there. Ongoing efforts to promote inclusion are evident in various societal settings such as education, employment, and community life. These initiatives aim to ensure that individuals with autism are not just included, but are also valued for their unique abilities and perspectives. Together, we can foster a society that not only understands autism, but also values the unique contributions of those on the spectrum.